Medical Supplement or Medicare Advantage? Please watch this video that's going to start here in about a second from ABC's Good Morning America so that you understand how Medicare Advantage plans actually work when you are in most need of a surgery, a specialist, or you want to take advantage of a friend or family member's referral of who you should go see either in your state or around the country. Okay, here it is.
But first, for all the politicking going on in Iowa, one of the most important issues on the table is getting little attention. Senior citizens in Iowa and all around the country are being bombarded with pitches for something called Medicare Advantage. Now, this is a privately run, controversial alternative to traditional Medicare. It promises big savings and better benefits, but there are serious concerns, which we learned through one woman's experience in our latest installment of GMA Gets Answers.
I don't like staying in the bed.
For a fiercely independent woman like 77-year-old Angela Dispenza, being stuck here is unbearable.
I don't want to be here. I got a house to take care of, bills.
But over the summer, this usually active widow from Queens, New York, slipped and fell. Instead of tending her garden or walking to Mass, Angela lay in bed, writhing in pain. She was rushed to the emergency room at Jamaica Hospital.
She had a fracture in her back.
Broken back?
Yes.
No question?
No question.
But when hospital staff asked Angela's insurance company, Oxford, to admit her, the company said no. Did you tell the woman from the HMO that she had a broken back?
Yes.
And what was their response?
That she's not for admission, that she did not need to be in the hospital.
Usually when seniors visit a hospital, they're treated immediately as part of Medicare. But Angela isn't enrolled in traditional Medicare. Like more than 8 million other seniors, she opted for an alternative program called Medicare Advantage, run by insurance companies. David Rosen is Jamaica Hospital's CEO. He says the program is shortchanging seniors like Angela.
We see frequent evidence of denial of care that would have been a no-brainer under the conventional Medicare program.
And government audits show the problems are widespread. Backlogs of patient complaints, improperly denied claims, and unethical marketing practices. In Angela's case, Oxford denied a series of requests by Jamaica's staff, including rehabilitation in the hospital. Doctors said it was Angela's best chance to walk again. But Oxford said inpatient rehab was not medically necessary. Unusual thing to request in a situation like this, rehabilitation?
Of course not. We had basically begged them, give us a week. Try her for a week. If she doesn't work for a week, then what are you going to do? You're not going to pay us anyway. We're going to be in the same boat we're in right now. Just try her for a week. No.
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 Surprised by what the HMO said?
Stunned.
Critics like Rosen say denying care for Medicare Advantage patients isn't good medicine, but it is good business for insurance companies.
They're making a lot of money.
Last year, Oxford's parent company, United Healthcare, made more than $4 billion. Some of that profit came from you, because Oxford and other companies are paid by Washington to run Medicare Advantage, even though government reports show it can cost as much as 20% more than the traditional program. Despite the higher price tag, critics say for some patients it's hard to see the advantage. In Angela's case, rather than keeping her in the hospital for rehab, Oxford sent her home in the back of an ambulance.
And she said, well, I guess I'm just going to stay in my bed then and die.
A week later, she was back at Jamaica Hospital with bed sores. That's when we met Angela. What would you say to the insurance company?
How dare you do these things to me? I was paying every year. I never failed to pay. That's why they took me in.
And now you just want to get
out
back,
of here.
get up and get home?
Yes.
But on your own 2 feet?
Exactly.
We asked Oxford United Healthcare to sit down with us on camera, but the company declined. And like many other times when we've tried to get answers, we were directed to the insurance industry's trade group and its spokesperson, Susan Pisano.
One thing you get if you join a Medicare Advantage plan is better benefits. You get broader benefits, you get lower out-of-pocket costs.
But while seniors may get broader benefits, here's the trade-off. Medicare Advantage plans decide what care they get. You know you have these protracted discussions about whether or not somebody even gets into the hospital.
It's not just a question of money.
What
People should be admitted to a hospital when they need to be admitted to a hospital. But
yes.
If they shouldn't be there, then a hospital brings risks with it that you shouldn't have to confront unnecessarily.
You think that happens a lot, that somebody goes to the hospital and doesn't really need to be there?
Okay, can I ask you, are we talking about a particular patient now?
No. Literally,
Okay.
I could be talking about hundreds of patients.
All right.
The insurance companies will not talk to me about the specific cases. How are you supposed to get answers?
Well, I think that culturally, it's not something that companies are attuned to, talking about specific, private patient issues publicly.
When they're bad. When they're good, they'll talk to you about them all day long. Like Joe Cameron, a favorite example for the industry.
Yeah, they're doing okay, aren't they?
While Oxford United Healthcare wouldn't talk to us, it did point us to this former Texas insurance salesman. Cameron says he survived a massive heart attack in 2002 thanks to United Healthcare's Medicare Advantage Plan, which paid for a quadruple bypass and several months of rehab.
My bill was $1,300,000. My copay was $1,700. That's an excellent coverage plan.
What United Healthcare didn't tell us is Cameron has been flying around the country to lobby in favor of the program. And Cameron says the insurance companies paid his travel expenses, including United Healthcare, the same company that sent Angela Dispenza a denial of coverage letter while she was still lying in Jamaica Hospital. Your name, your identification number. Now that letter said Angela could appeal the decision. So with her permission, GMA did just that. And a month later, we got a response. The letter didn't say if Oxford was wrong to deny Angela's care or even who would pay her bills, but it did say that the issue was not for Angela, that it was between Oxford and Jamaica Hospital.
Yeah.
Lucky for Angela, Jamaica Hospital gave her inpatient rehab, providing the same treatment Oxford called not medically necessary. And look at her now. Angela is back on her feet, walking, and she can't wait to go home.
I'll be dancing. I'll be dancing.
She will be dancing, and she's beautiful. Again, Angela was lucky here because she got the rehabilitation, and the insurance company said she won't be billed for it. But Jamaica Hospital says it still hasn't been paid by Oxford and doesn't think it will be. In fact, the hospital's parent company is suing Oxford in federal court over issues just like this one. And Kate, we talk to a lot of experts who say patients aren't as lucky as Angela very often, that they get turned away by the hospital, and that this is something people have to think about.
Let's point out what the difference is in Angela's case. That letterhead from ABC News.
Maybe. This hospital, to be frank, Jamaica Hospital is lobbying very actively on her behalf. But
so it could be partly that, too.
It could. But we like to get involved in these things because you see someone like Angela, and it takes your heart, and it hurts it because
but
you want to see
wonder how many other patients out there could use a letter from someone like you to go after the system.
That's exactly right. And that's why we do the stories, because the more people know about it, the more we pay attention, the more people there are to help people like Angela.
Wow, right? I mean, there's thousands of other YouTube videos and articles about situations like this that go on all over the country. You can talk to specialists in your neighborhood or medical providers. Ask them what happens when they go to get an approval for a surgery. I mean, that lady's back was fractured. Unreal. Okay, so here's what it's all about. Unless you have health issues that prevent you from choosing a Medigap plan, you really have to think about the size of the gamble of the bet you are making by choosing to be held captive by a PPO or an HMO. Now, if you have a health issue and you have to be in a Medicare Advantage plan, you must find a true Medicare Advantage specialist. They are very hard to find because there are usually 6 to 12 plans per carrier. And due to the government regulations imposed on them, they are only allowed to show you the benefits of each plan. They are not allowed to share their opinion about what the best one is. If you said, thanks for sharing these 2 different insurance carriers, half a dozen plans, you know my situation, which one's the best one for me? They're not allowed to tell you that. How nuts is that? Okay, now I have carefully hired the best Medicare Advantage specialists in the country to work on our team, and I can help get you in touch with them. Now, I personally will not sell an Advantage plan. You have to absolutely be a unbelievable devoted student of Medicare Advantage plans to really offer the best care. If you make a decision to abdicate your Medicare benefits, by signing up with the Medicare Replacement Program, because that's what it is. It's known as, this Medicare Advantage. You may have literally signed your own death certificate, and here's why. You saw what happened to the lady in the video, but it's worse in a lot of situations. Now, did your Medicare Advantage insurance agent ever tell you that? Of course they didn't, because it's against the law for them to do that. The agent trying to sell you on this free Advantage plan won't tell you this. In fact, during the agent's mandated annual AHIP certification and training program, they are reminded that they cannot even tell you that you no longer have the benefits that Medicare affords you. And if I seem a little bit passionate or excited about this, it's because I am. I just got off the phone speaking with a prospective client who was really being hard sold by an insurance carrier's captive agent and how spectacular the Advantage plans were. And when I asked her a few questions, she said, no, they didn't tell me that. No, they didn't tell me that. So I had to make this video for you. And again, that's why I'm so excited today. All right, I'll stop with the quotes. I want to help you out. I'm going to help you do some due diligence and really educate yourself. And so I want you to check out a couple of things before you lock yourself out of the benefits you worked your whole life for, right? That red, white, and blue card, you worked your whole entire life for that card. Now, under original Medicare, you can go to any provider in the country that accepts that card. Ask any agent pushing this free replacement plan if that's true under the Advantage plan. It's not. While you are on the phone with an agent, ask them this. Hey, if God forbid I get cancer, can I go to MD Anderson Cancer Center at the University of Texas, where some of the best cancer specialists in the country are? The answer is no, you can't. You just can't do that. So, or ask them this. Can I go to the local cancer treatment center that accepts the regular Medicare red, white, and blue card? Okay, we have phenomenal cancer centers here around Michigan. Carmano's Cancer Center, I mean, there's dozens of them, but you just can't choose to do that on your own without getting a referral in most Medicare Advantage plans. So here's one of the reasons that the agent can offer this free plan. These plans are government subsidized plans. This is the essence of managed care. Who's managing your care? IPAB, or Independent Payment Advisory Board, was set up by President Obama to make decisions on Medicare spending. They are the almighty decision makers that decide who gets a necessary, sometimes life-saving surgery and who doesn't. Remember the lady in the video at the beginning of this video? Good Morning America surely isn't some right-wing organization, right? Again, I am passionate about helping you understand that if you willfully choose the Medicare replacement insurance called Medicare Advantage, you may have literally signed your death certificate. Managed care providers, right? That's what these are. We're talking about managed care providers. They have already been paid for your health care. And that is why they, aggressively as possible, are going to manage the amount of quality care that you receive. Ask yourself this question. Throughout your entire life, have you ever received anything of real value that was free? Of course you haven't. There is nothing free in this great country of ours. And that's why you should be wary of this heavily marketed free plan. I can't stop with the quotes, sorry. So, this is what I've seen, and if you look at it, do some research online, this is what you'll see, or it's what you've experienced, or your friend has experienced. We have seen the maximum out-of-pocket costs increase from $1,000 to $2,000 up to $6,700 now in just a few short years as of this recording. Up to $6,700 every single year if you're on that Advantage plan. The costs are going up and the benefits are going down for this free plan. There are thousands of articles about it online, okay? The only time you should consider, and there's only one time you should consider a Medicare Advantage plan, it is due to health or financial reasons, period, end of story, okay? My mom, who was on the legacy plan here in southeastern Michigan, okay, with BCBS, her plan just went up 300%. Well, I just took her through looking through a plan, a Medicare Advantage plan, the pricing of it. The pricing was north of $160 per month. She's almost 75 years old. And I was able to get her onto a Plan G, okay, which is spectacular. View my video on Plan G for $20 less per month. Okay, so you've got to be very, very careful what you're being sold. The solution to the problem is the medical supplement plan choices that all of the top insurers offer. Remember, it's called Medigap also. Medigap, medical supplement plan, same exact thing. Medigap plans allow you to keep original Medicare plans that cover 80% of all of your hospital and doctor's office visits and cover the remaining 20% of the Medicare approved claims. You worked your entire life for that precious red, white, and blue card. Hold on to it with your life. So what does that red, white, and blue card mean to you, to my mom, to my dad, my uncles and aunts? Why do they guard it with their life? It means you still have all of the benefits of the Medicare that affords you the flexibility of going to see any provider, any specialist in the country that accepts original Medicare. It means that you do not have to deal with the wild swings or ups and downs that come with the quote-unquote free Medicare Advantage plans, which most of them aren't even free anymore. Some of them are north of $200 per month, more expensive than Medigap plans. Now, what I'm about to tell you is clearly spelled out in your plan summary benefits section. Read it before you choose to ignore reality. Read the plan summary benefits of any Med Advantage plan and give me a call if you hear something or read something different than what I'm telling you. Okay, so this is what I want to talk about. This is really a question I want to ask you. Do you know anybody who's gotten cancer, had a stroke, had a speech impairment from that stroke? Here is their reality check if they have a Medicare Advantage plan, very similar to the lady that Good Morning America featured at the beginning of this video. They are going to be forced to go to one of the approved medical facilities and use one of the limited providers in the managed network. A provider that has agreed, a doctor, a physician, a specialist, a provider, right, that has agreed to the low monthly capitation rates that they receive to take you on as a patient. They've already received the money. So both the provider and the facility is now financially incentivized to keep their costs low, which oftentimes means shorter visits, quicker care, so they can see more patients. It's really not their fault. It often means you have to start out receiving the inexpensive treatments first before you're actually prescribed chemotherapy. I know, it's crazy, but this is what's going on. Now imagine dealing with this reality in addition to just finding out that you have cancer. Do you know anybody who has cancer? Had a stroke? Again, speech issues because of that stroke? Of course you do. So why would anybody that has not lost their mind choose an Advantage plan unless they have poor health or cannot afford a supplement or Medigap plan? They wouldn't unless they were improperly sold or talked into that Med Advantage plan. In addition to this nightmare scenario I just shared with you, which goes on all the time, the Medicare Advantage plan only covers 80% of the bills each year. Imagine having to receive less than optimal care and have to pay up to $6,700 every single year on this free plan. Picture going through chemotherapy year one, and then, after the Christmas party, New Year's party, holiday party, the family celebrations that go on at the end of every year, you find out that because your chemo is still going on, you have to pay $6,700 again. With the Medicare Disadvantage plan, your maximum out-of-pocket costs reset. Yes, they do. You have to pay up to $6,700 again every single year. So if you have good health, but tell me or tell any other agent that really cares about you that you cannot afford a medical supplement plan that you actually qualify for, you've got to ask yourself this question. Can you afford up to $6,700 out of pocket every year? God forbid you get cancer or have a stroke or have any of the other things that can happen to us human beings. With Medicare Advantage, you have to jump through all of the hoops of getting referrals, pre-approvals, and paperwork to get the care you need, which is only unique to Medicare Advantage. Can you imagine having to deal with that while you just found out that you have this horrible illness? It's crazy. Now, in my opinion, I want to know what you think. Do you think it should be illegal to actually call this thing Medicare Advantage? You have to give up your red, white, and blue Medicare card. Okay, so listen, let's get on to some good news. What's the good news? The good news is that with Medicare Supplement or Medigap plans, you have the exact polar opposite of Medicare Advantage plans. With a supplement plan, there are 0 hoops to jump through to get to the best medical facility, to see the specialists of your choice. If you have cancer, you can go to MD Anderson Cancer Center. In fact, a quick story here. There's a gentleman, Jack, that works for us. He's a senior. He's a health insurance expert. He had a surgery here in Southeast Michigan. The person botched the surgery. His left arm was locked in place. He couldn't golf anymore. And what did he do? He found the best orthopedic surgeon in the country, in his opinion. It was actually a referral from family and friends who was in New York. He called them up, asked them, do you take the Medicare red, white, and blue card? Do you take Medicare? Basically, they said, yes, we do. Great, I want to schedule a surgery. No problem. Schedule a surgery, goes out to New York, and voila. He's moving like a ballerina again. I'm sure Jack wouldn't like me to call him that, but back to his golf game, perfectly feeling great. Now, do you think that would have happened on a Med Advantage plan? Of course it wouldn't. In fact, Jack, that's what got him so passionate to come out of retirement and get back into just the senior market only. He didn't sell Medigap insurance plans before, and now that's all he does. He experienced this firsthand. And again, that's why I'm so passionate about it. You're going to receive the best care, cutting-edge testing procedures, and so much more. Remember, with this Medigap plan, you get to choose the best oncologists, get referrals from trusted family, friends. You can read online reviews of the best providers and make appointments right away without having to jump through any hoops, without having to deal with the maze of regulations and rules that these awesome Medicare Advantage plans force you to deal with. Now, if you are forced to choose a Medicare Advantage contract due to financial hardships or a health issue, I truly feel for you. And that's why my partners and I spent a lot of time hiring the best Med Advantage specialists, okay? These team members are experts at helping those who need the most help, those who do not have the financial means to pay for a supplement plan or in poor health. I want you to know we are there for you. Last thing, if you are still healthy, and we're duped into a Medicare Advantage plan, there are certain timeline rules that stipulate how to leave the Medicare Advantage plan, but there are strict regulations on how to accomplish that. I want to help you unbind yourself from this plan. I'm here to help you. You can call me anytime, call any independent Medicare specialist, but just get off that plan if you are healthy enough to do so. I want to be your Medicare concierge for life, so of course I hope you call me. I'll leave you with this. If you are blessed to be able to choose between a Medicare Advantage plan and a medical supplement plan, I hope I've made it easier for you to understand why a Medicare Supplement Plan, a Medigap plan, is your best option. God bless you.